Hello, hi everyone. Welcome back to my channel. It's Dr. Erica on Ebola pharmd for close to 10 years, and I'm coming back on this particular chat for a product vlog. These are medicated products, so these are products that I suggest that I've taken before and have suggested for travelers who are traveling abroad, who are traveling to other countries, who may not have access in those countries to an industrialized pharmacy type care system. So before you go, make sure you have these in your medication luggage, and make sure that you are not only just sticking to what I suggest, but specifically getting those items that are prescription, getting those items that may not be included in the list that I have that you may take for a specific reason, like, such as your diabetic devices, things like that. Also, diabetic creams that I might not mention in this video. Do consider those if you are taking those or need extra care. Okay, so I have mainly about 15 to 16 medicated products that I suggest that will be helpful to you during your travel overseas to another country, or any rural or remote area where you may not have adequate care, or may just want to go ahead and be ready now before you get to another place, which is what I suggest. You want to enjoy your trip, not have to look for medications and health care. So this is what I recommend: about 15 classes of medications. First is going to be for pain. So most likely you won't have to deal with pain, maybe pain such as joint pain or migraine pain. So if you think you might be able to deal with, have to deal with that type of situation overseas, or you may not have to. Just in case you do, it's good to have a pain reliever on board. And I suggest an NSAID, a non-steroidal anti-inflammatory drug. They help with inflammation, redness, soreness around the redness and inflammation, and they help with pain. So I suggest an NSAID, such as an Advil. Advil, such is a brand name for ibuprofen. And I have one here, ibuprofen 200 milligram, and it's a coated product, and there's 50 in a box in this particular one, but you can choose any type of NSAID, any quantity. I would suggest maybe a box of 15 to 20 or more, a small box for mild, moderate pain. Okay, I would suggest that you take it as prescribed. Um, and it works in about 15 minutes, and it lasts for about 6 hours to 8 hours in a day. So do understand that NSAIDs, non-steroidal anti-inflammatory drugs, are good medications for pain, inflammation, and redness and swelling as well. So do consider that. Second on my list, you might want to get something to write with, some sort of piece of paper to make sure that you're keeping up with my list. But your list may be smaller, your list may be longer, more specific for you. But the list that I have is about 15 comprehensive meds that I think are very important as a pharmacist. Okay, second is going to be for constipation. We travel, we eat, we maybe overeat, we may feel uncomfortable at times where we're not able to use the restroom regularly. We should use the restroom once a day. We should have one bowel movement once a day, and if we don't, then we can consider a stool softener or a stool laxative. And I have one in mind. It works overnight, and it's very natural. It's a vegetable origin, and I suggest Senecot. Senecot is known all over the world, so it's all natural. So you may be able to find it overseas, but again, I would recommend that you have this on board and ready for you, and it's extra strength. This one is extra strength. It's a vegetable laxative, and it works overnight. There's 12 tablets in this small box. A little convenient pack. I would suggest it. And the active ingredient is be the Sinoside, 17.2 milligrams. Directions are for adults and also children ages 6 to 12 years of age can also take half a tablet once a day, up to one tablet twice a day. So do consider if you're taking along children as well. It's good and it's healthy for the whole family. I suggest that you take it, and it should work in about 6 hours to 12 hours. Take it with something to eat as well. And again, it's all natural. So that's second on my list, Senokot. Okay. Next on my list is going to be not only for constipation, but for diarrhea. So when you eat overseas or you want to eat and you indulge and you have that diarrhea experience, try Imodium. Imodium is good. Loperamide, 2 milligram. It also has an anti-gas relief. So anti-gas relief of 125 milligram. And I also have a gas relief right here as well, just in case you don't get Imodium for diarrhea. You can get separately simethicone, which is an anti-gas relief, simethicone 125 milligram, and then the loperamide is the active ingredient for Imodium, and it is good for diarrhea. And it has multi-symptom relief, cramps, bloating, and gas, and pressure. So do consider Imodium for diarrhea relief. So that's very important to have on board. And then here's the gas relief that I suggest. Gas relief, simethicone, 125, soft gels, and the directions on it for adults only. Swallow with water, 1 to 2, as needed, after meals and after at bedtime. So I do recommend it as well. The GI tract, eating, not eating foreign spices and so forth may have an adverse effect on the GI tract, just because your system or anyone's system may not be accustomed to the ingredients in certain foods, or the certain meats that might be served may have a different tenderness, things like that may cause the GI tract and intestines not process it regularly. So do consider anti-diarrhea, anti-constipation, and antacid as well as my next drug of choice. Antacids are going to be your Tums. Tums antacid. This one is 72 chewable tablets of the Tums, and the active ingredient is going to be the calcium carbonate, 1 gram. For acid indigestion, sour stomach, heartburn, upset stomach, I would suggest a small bottle of antacid. And then also, I have this antacid as well, Rolaids Advanced antacid plus anti-gas medication. Okay, and it has a fruity flavor with it for multi-symptoms as well. And this comes in this small, convenient pack. This pack is so small and convenient, it fits right into your pocket or right into your luggage. Take it right along with you. Has some methicone in it, magnesium, and calcium carbonate as well. So it treats gas and heartburn all at the same time. Okay, a good traveling pack to have. Okay, so now that we've talked about the GI system, diarrhea, constipation, indigestion, upset stomach, Okay, let's move along to allergies. Okay, allergies can happen just because there are foreign florals, there are foreign insects, there are foreign pests and pesticides when you travel. So do have an antihistamine on board. The vegetative system should be a whole lot different in other foreign countries. Just because you're not accustomed to them, you might want to go ahead and have an antihistamine and a cream and maybe a steroid, a cortisone steroid ointment on board in your luggage as well. So I have generic Benadryl. Diphenhydramine is the active ingredient in Benadryl, and it's good. It works. It works fast. It's a first class antihistamine, so it may cause some side effect of drowsiness. So be aware of that. It's good for runny nose, itchy nose or throat, sneezing, watery or itchy eyes as well, because that immune system is going to respond, and so you have to have something on board that's going to help reduce that. Okay, and that's going to be your diphenhydramine or Benadryl. Then I also have another class of antihistamine, which is your loratadine. Loratadine is also known as Claritin brand name, and this particular class is non-drowsy. So it's different than the Benadryl because it's non-drowsy, but some people have said it still causes them drowsiness. So do your due diligence, find out which antihistamine class is best for you, works best for your complete system. I suggest that you take this along, and it's a 24-hour relief. So it works once a day. Whereas the Benadryl, you're gonna have to take it a couple of times a day to get the full coverage, and that is your antihistamines. So those are what I suggest for allergies. If you're allergic to seafood, if you're allergic to certain animal groups or certain vegetative groups, do go ahead and have on board antihistamine class, plus a corticosteroid ointment and cream. That helps topically with rash, redness, inflammation, itchiness as well. And also, I will have another product here that is good for um, contact with poison oak, poison ivy, sumac, all those environmental trees and things. If you're going to be in a close environment with poison ivy, things like that, it's good to have this particular product on board. And it's a soak, actually. Domboro is an astringent solution providing soothing relief of minor skin irritations, and it's been on the market for over 50 to 60 years. So it is highly known and highly recommended. It helps with burning, helps with skin to skin contact with metals as well, with plants, with vegetative items. So do consider Domburo along with the corticosteroid, along with the antihistamine. You don't have to take the whole suggestion that I have. Choose what's best for you. One, the length of your trip that you'll be overseas. Two, the activities you'll be participating in while you're overseas. So do consider that as well. And three, consider also if you're going to be traveling in a group or you're going to be traveling alone. How's the pharmaceutical and medical staff in the area that you'll be staying? Do consider those items as well. Okay, so now that I've gone over the GI tract, I've gone over allergies as well. So let me move on to first aid. I'll go on to first aid. When you're dealing with first aid, you want to have band-aids, possibly a small pack, convenient pack. You want to have wipes, sanitizing wipes, maybe excuse me, ethyl alcohol wipes, just in case you have to deal with burns or small cuts, what have you, you might want to go ahead and deal with picking up some items for that. And I recommend a triple antibiotic ointment, and that is just bacitracin, and it is active ingredient neomycin and polymyxin as well. And I do recommend it just in case you come across the need to have a healing salve on board. Then, if you can't, or you want to add something else, add petrolatum. Petrolatum is good as well. This is Aquaphor Healing Ointment. If you experience, again, any cuts, burns, it'll be helpful to add that, apply that to the abrased skin, and then apply your Band-Aid. Okay. And then I want to go over also items for motion sickness. While you're traveling, it's good to have meclizine on board. Meclizine is a antiemetic, which helps with nausea and vomiting. So before you travel, before you get on a plane, before you get on a bus, or do some sort of type of travel within the compounds of the actual country you're going to be in, do take on board meclizine and ingest it 30 minutes before you get on the actual transportation, just because this product is going to begin to work and actually start working and last up to 24 hours to prevent that nausea and vomiting and dizziness type feel. And this is a convenient all-day travel pack. It comes in a small tube, and you can just fit in your pocket or what have you. And yeah, take it 30 minutes to an hour before you start to travel. Okay. And it is for adults as well, and those who are over the age of 12. 2 tablets once a day, max. Okay. I do recommend it. It's called Dramamine, or meclizine is the active ingredient, and it is over the counter as well. I would definitely put it in the traveling section for sale so that it can be picked up, because most patients that come in asking for Dramamine is very frequent. So good to have on board. The next thing I want to recommend, because people travel across time zones, and experience jet lag because of the time change, I do recommend a medication for sleeping aid and a medication for alertness. So just in case you might think you're going to experience those, try caffeine 200 milligram. And this brand is called No Dose. No Dose to help with alertness. Okay. And there are coupons that are inside the box. So it's not expensive, and it helps children of the age greater than 12 and adults as well. You can take it as much as every 3 to 4 hours. Okay. So I do recommend it. And it is fast acting, and it's maximum strength, just in case you may experience sleepiness. Okay, that's No Dose. And then if you experience the opposite, there's something for that as well. So if you start to feel too alert and you can't fall asleep, go ahead and have before you start to travel, go ahead and start taking melatonin. Melatonin, 5 milligram, can be taken at bedtime and increased to 10 milligram as needed, just in case. It'll help you stay asleep. It'll help regulate your sleep cycle so that you'll feel more naturally accustomed to the time in a particular time zone, or after getting off a plane or traveling for so long, you will have that experience of a natural sleep and wake cycle. Okay, with sunrise and sunset. Okay, so next on my list, I've gone over GI tract, I've gone over antihistamines, I've gone over sleep, I've gone over pain, first aid. Let me go over multivitamins, including probiotics. Multivitamin for men and for women is good to help regulate the amount of vitamins, minerals, essential vitamins, all of those in one capsule once a day, to ensure that you are getting adequate amounts besides that from your normal diet. Okay, so I do recommend multivitamins, and I can show you some here. These are for men and for women. This is a multivitamin for her, and includes vitamin D3, calcium as well, and iron. And it's one taken once a day with a meal preferably. And then I have that for men as well, multivitamin for men, soft gel. So I do recommend taking a multivitamin as well, just to help with dietary supplement. Herbal supplements are good as well. If you take an herbal supplement, do make sure you have that on board with you. If you take a mineral supplement, such as chromium, do have that on board. All your essential vitamins and minerals that you normally take on a regular basis, do take those with you as well. Be accustomed to taking them on a daily basis. They do have that benefit, because we always don't eat a diet that's completely nutritionist, or a meal that has adequate portion sizes of our vegetables that we're supposed to have, or our fiber that we're supposed to have, or our protein that we're supposed to be ingesting. So do have a multivitamin on board as well. Even before you start to travel, it's good to have it. I want to go over probiotics. Since we just talked about the multivitamin, the probiotic is a precursor to any effect or any medication that might alter the GI tract, any particular episode of diarrhea that may occur occasionally, that might wash out the intestines and remove that good bacteria. Probiotics and prebiotics are good for that. I have a video on probiotics. I want you to visit that video as well. I talk about digestive advantage that you can take on a daily basis to help deal with diarrhea, help deal with effects of antibiotics, certain medications that might cause irritation in the GI tract. So do recommend a probiotic as well. And here's one that I have. It's a gummy form for adults. And this particular one provides energy with it as well. So you can find digestive probiotics with different formulations. But I do recommend having a probiotic with you as you travel. Okay, last but not least, I want to talk about the eye care. Eye care is good as well. Dry eye, red eye, allergies that may cause runny eye. Do have an eye liquid on board, a lubricant, and this one is a lubricant just in case you have that dry eye or irritation. You have something on board to help replenish that moisture. You don't want to go and travel and have irritation in your eyes. So I do recommend having one of those particular ones on board as well. I travel times overseas, and it's good to have on board already medications that you think you may be dealing with, especially if you're having contacts, soft lens contacts on the eye, or if you have dry eye tendency or allergies, allergies anyway. go ahead and have a antihistamine. Also, go ahead and have some eye drops on board for redness, for lubrication, and antihistamine eye drops as well. That's what I want to recommend. Last but not least, cold and flu. This particular cold and flu has dextromethorphan, phenylephrine, and Tylenol. And they help with pain, nasal congestion, sinus pressure, all of those pressures that we tend to deal with during the cold and flu season. This will be dealt with through, and also pain that's caused headache, migraines that viruses and bacteria may cause during the cold and flu season. Would it be good? And this one is let's see. These products are comparable to Dayquil liquid caps as well. These are non-drowsy daytime relief convenient pack that you see. So, and it's a small convenient pack, and there's 10 in here, 10 soft gels in here. So do consider adding that to your list of medications. Okay. And that's all that I want to have present to you today. If you have any questions or comments, please let me know. I am definitely interested in giving more tutorials on medications that I suggest for traveling overseas, especially if you're not going to be in an area where the medical field and the pharmaceutical field is not very leveled to what you're experiencing with here in the States or in other countries where you're from. Do consider any item that I've listed, plus any item that you've already taken or maybe regularly taken through prescription. And get your prescriptions filled at least 2 weeks to 4 weeks ahead of your traveling. That way you don't have to worry about getting those prescriptions filled overseas or in other countries. You already have them on board. Most insurance companies will consider that and give that a try and let you get your prescriptions filled ahead of time. Just as long as it's covered, you should be okay to get those prescriptions anyway. So I would suggest that you do that. Talk with your pharmacist, talk with your healthcare provider, let them know that you will be traveling and that you'll need an extra prescription to get medications filled early. So thank you for joining me. I'm Dr. Erica, and I hope to see you on this video. I hope it was very helpful for you. Thank you. Like, share, and subscribe. Bye-bye. Peace.